Thank you, Pat. Good afternoon, bon après-midi. I hope you all had a good weekend, and I hope everyone managed to get some fresh air this weekend and enjoy some exercise. It's important for us to pace ourselves as we go through this pandemic experience. We know that we're in this for the long haul and that we need to look after ourselves physically as well as mentally. Only a few days ahead of us is Easter weekend, and again, I do encourage anyone who can to get outside for some fun, celebration, fresh air, and exercise. However, I ask that in observing the long weekend, you stay safe from COVID risk and safe in every other way. Observe the rules of physical distancing and avoid gatherings, even outside, of more than a few at a time. Be prudent on your backcountry or backyard skis, or while hiking, or on your snow machines. If you have parties, keep them low-key, safely spaced. Avoid gatherings of more than a few, and avoid excess alcohol or recreational drugs. Let's not be in any situation, outdoors or in, where we may need to be rescued or need emergency treatment. Apart from safeguarding yourselves and your loved ones, we need to keep our first responders and healthcare workers free to respond to the needs of the pandemic. And if you are unwell, please don't go anywhere. If you're COVID positive or a contact of a case and required to self-isolate, then you too, unfortunately, need to stay home and strictly self-isolate. We need to do what we've been doing so well so far and continue to protect the whole community. Yukon's case count as of today increases by 1. Case 7 was confirmed on Saturday and involves a Whitehorse individual who returned from travel to Europe. As with our other cases to date, this case was in self-isolation throughout and is doing well at home. We are pleased that so far, no Yukon cases have required medical treatment. Le nombre de cas au Yukon a ce jour augmenté par 1. Il s'agit, comme la dernière fois, d'une personne de Whitehorse qui est revenue d'un voyage en Europe. Cette personne respectait aussi les mesures d'auto-isolement et à ce moment continue de poursuivre son isolement à la maison et se porte bien. I want to be clear that these are not cases that keep me up at night. We will continue to see these cases pop up like little arrows trying to penetrate the armor we have created, an armor of safe physical spacing, of hand washing, and of restricting or reducing travel, whether to Yukon or within our beautiful territory. Aligned with this public health response, our public defense will easily hold against these viral incursions as long as we maintain our guard. The risk to the public from any of these 7 cases is low, as they have all been well contained. The risk to the public is more from the unrecognized infection. Thus, our defense strategy includes continued aggressive testing, as well as continued persevering adherence to physical distancing. A word about contact tracing. This may be something that bears, again, some repetition but further explanation. Whenever new cases of COVID-19 occur in the territory that can be traced to a particular person, public health, or that's the Yukon Communicable Disease Control, or the community nurses will call anyone who has had close contact with that person. This is called contact tracing and is bread and butter public health for a variety of infectious diseases to make sure that they do not spread or cause outbreaks. We do this with COVID in the same way. People who have had close contact with someone who's infected will be notified individually, and the steps they need to take will be explained to them, such as monitoring themselves for symptoms or self-isolating. The risk of infection is determined case by case, and people will get specific advice according to their particular circumstances. This includes contacting by using flight manifests if needed, or public postings of potential locations where transmission may have occurred. One day, you may yourself get a call. If so, know that the system is working well and that this is part of the process of keeping everyone safe. On masks and face coverings, many people are asking questions about masks and homemade face coverings or masks in particular. How valuable are they, and could they be a key to the success that some countries have had in reducing COVID spread? The most important points, as I see it, are the following. The first and most important thing is to remember that wearing a mask does not replace physical distancing, hand washing, or any of the other measures we should all be taking to help prevent the spread of COVID-19. Second, we need to make sure the supply of medical masks goes to healthcare workers. They need them for medical procedures, and they need them for caring for people who are infected. So, what about homemade masks? Is this where we should be going? And I would answer in this way. Wearing homemade masks is not a proven measure. In particular, a homemade mask has not been shown to protect the person wearing it. It could be, though, that wearing a mask, particularly in crowded settings, can be a way to help reduce the chance of you infecting others. In other words, think of cloth masks as another way to cover your face when you cough. Covering your mouth and nose can reduce the chance of respiratory droplets from contaminating others or landing on surfaces, just like covering our coughs with tissues or a sleeve might do. Wearing a mask might also make you feel safer and help stop you from touching your face. It can also reasonably be used in situations where physical spacing is not possible, although the best measure is to avoid those situations in the first place. I'll say a few words of that in French. Pour les masques, le point le plus important à retenir est que le port d'un masque ne remplace pas l'éloignement physique, la distance physique. Il ne remplace pas le lavage des mains ou toute autre mesure que nous devrions tous prendre pour empêcher la propagation de COVID-19. En particulier, il n'est pas été démontré qu'un masque fait à la maison protège la personne qui le porte. Cependant, il se pourrait que le port d'un masque, en particulier dans les endroits surpeuplés, puisse être un moyen de réduire les risques d'infection pour les autres. Pensez au masque en coton, en tissu, comme une autre façon de couvrir votre visage lorsque vous toussez. If you do decide to wear one, you will need to wash your hands when you're putting your mask on or taking it off. And it's also okay if others around you are wearing a mask that you shouldn't feel pressured to wear one, unless you have been specifically instructed to wear a mask, such as in caring for an ill loved one. You don't need to wear one. I'm going to stop there and let Minister Streicker continue.
Thanks, Dr. Hanley. Good afternoon, everyone. I'd like to thank you all for joining us today, and I'd just like to begin by welcoming and thanking Diarmuid O'Donovan. He is our Civil Emergency Planning Officer under the state of emergency. And Diarmuid and his whole team have been working extremely hard over the past, well, it's probably months now, but certainly since we declared a state of emergency, and I just want to say thank you. And I'd also like to say thank you. There are a group of people that work in the background, and today let me thank all of the technical folks who are putting this together, just to say thanks. I know that you're working hard to help us connect with Yukoners, and that's terribly important. I also want to thank Yukoners. With the uncertainty surrounding the progression of COVID-19, the last few weeks, and the very real likelihood of more challenges to come, I want to say thank you for the sacrifices you have made and for the sacrifices you will have yet to make. This past Thursday, we announced important measures that the Yukon government is taking to make the Chief Medical Officer of Health's orders enforceable under the Civil Emergencies Measures Act. You'll sometimes hear us call it CEMA, as well as some additional measures to strengthen our ability to enforce the health protection orders. I'm here today to speak in more detail about how we will be using the Civil Emergency Measure Act to reinforce these orders at Yukon's borders, measures we are putting in place to help keep Yukoners safe. As set out in an order under the Civil Emergencies Measures Act, any person entering into the Yukon will now be stopped by a CIMA enforcement officer and required to provide contact information, detailed travel plans, self-isolation plans, a declaration, and more. Failing to do so is punishable by law. As of 8 a.m. this morning, there are now CIMA enforcement officers stationed 24 hours a day, 7 days a week at the border south of Watson Lake on the Alaska Highway and at the Stewart-Cassiar Highway border. In addition, CIMA enforcement officers are stationed at the Whitehorse Airport to meet incoming flights as passengers arrive from out of territory. Our international borders at Skagway, Haines, and Beaver Creek will continue to be staffed by Canada Border Service Agency officers who are coordinating with the CIMA enforcement team to comply with our new regulations and following the same measures. And I'd like to say thank you to Minister Blair for working quickly and seamlessly with us on that front, and for the federal team generally in helping us out. Thank you. As I said at last week's announcement, the Emergency Measures Health Protection Order now in place requires that all travelers to the Yukon must self-isolate for 14 days. Travelers entering the Yukon from any border can expect the following. They will be required to stop, make a declaration that includes their name, address of their ordinary residence, and phone number. If the individual does not normally live in the Yukon, but is providing an essential or critical service, they are to provide information about all places in the Yukon where they plan to go, along with a declaration that they are not symptomatic. For those people in transit, they may pass through as long as they do not remain in the Yukon for longer than 24 hours. They too must take direction on how to move through our territory so as to limit potential contact with Yukoners. There are accommodations within this law for critical service workers and for residents of northern BC in the Yukon border communities like Lower Post and Atlin. These accommodations are intended to include these neighboring communities within the health protections plans of the Yukon, given our close ties and relationships and recognizing that they get essential services from the Yukon. Critical services are services that preserve life, health, and basic function of our Yukon society. These services include health sector workers, first responders, and many of our critical infrastructure workers. I want to be clear. The Emergency Measures Health Protection Order gives force to the order of the orders of the Chief Medical Officer of Health to Yukoners are enforceable under law and were put into action starting today. This means that failing to comply is punishable under law with a fine, imprisonment, or both. Yukoners, I spoke a little while ago about thanking you for sacrifices you are making. With the Easter weekend fast approaching, I know some Yukoners are hoping to head into the backcountry. Our message to all Yukoners today is to say no to the backcountry trips like Skagway and Haines Passes and other areas where groups have often gathered in the past. Dr. Hanley has spoken about the importance of going for a walk and getting outside while keeping a 2-meter distance between ourselves, or about 1 caribou apart. We are saying yes to fresh air, to exercise and active living. We are saying no to congregating, no to any folks being closer than 2 meters apart, and no to riskier backcountry activities. Remember that if you get hurt and need to call for help, we are automatically putting our first responders and our search and rescue folks at risk to help you. and no to non-essential travel to our communities. This past weekend, I spoke with Chief Smith of the Champagne and Asiac First Nations and Hashaduhan Dixon of the Carcross Tagish First Nation. Both of them talked to me about the risk all of the visitors are putting on their communities. We know spring is calling, but right now we have to keep our communities safe. The mountains aren't going anywhere soon. Thank you again to all Yukoners for making this sacrifice right now to keep us all safe. And I just know that just before I got here for this live broadcast, I got a note from Chief Dixon, and she said, and I quote, "We want to ensure that people do not come into our community looking for recreation and fun," end quote. Once again, I want to thank Yukoners for their resiliency and courage as we face this unprecedented time. It is in our power, each of us, to determine how COVID-19 will affect us. Thank you for doing your part to prevent the spread of disease in our territory. We will get through this together. These measures are meant to reduce risk for Yukon's most vulnerable communities, and we all must take them seriously, be kind, be gentle, and support each other by staying physically apart. Thank you. Merci, Masicho, Ganashish.
Thank you, Minister Streicker. We'll go to the phone lines now. Again, if I can just remind you, one question and one follow-up, and then we'll move on to the next outlet. We'll start with Steve from CBC. Are you there, Steve? We can come back. Julien Aurore-Boréal.
I'm here. Can you not hear me? Yes. Hello?
No, we
Can you hear
can't.
me?
We can't
Hello?
hear you.
You can't hear me.
Okay, now we can hear you.
Okay. I didn't touch anything. So, anywho, this is Steve from CGC. So this question is for Dr. Hanley. Before, I think around a month ago, when you held one of the first few press conferences on COVID-19, you and your colleague were relatively adamant that you weren't going to release the names of the communities with COVID-19. Can you please explain what's changed? Because you guys had said that you would not even reveal if there was a case in Whitehorse. So what has changed, and does this mean that if there's a case in Watson Lake, for example, would you be revealing that?
So our policy has always been to identify Whitehorse as opposed to rural communities. So our policy is to give as much information as we can safely without compromising identity of individuals involved, unless there is a compelling public health reason to do so. So if there were a compelling public health reason to disclose a community by name, then we would do so. Otherwise, the distinction is very similar to what we do for other communicable disease reporting, and that is Whitehorse versus rural.
Steve, do you have another question?
And I could follow up?
One follow-up, yeah.
Well, if I were, I could bring up the tape again, but I'm quite certain that your colleague said that Whitehorse would also not be revealed. Those cases in there. But so if a chief or like some kind of political leader here of a community does request that information be made public, how would you respond? And also, can you kind of compare and contrast that rule here? Because I know in other jurisdictions, including another territory, they are going to be naming those communities. So would you say that that other territory is wrong in this case?
So my comments are about my territory, our territory, for reasons that are relevant to our territory. We work very closely with the other territories, but because of different imperatives, different demographics, many different considerations, they may choose to go in other directions. Our neighbors, Northwest Territories, have the same policy as we do, and none of it, for their own reason, have a different policy. That was the second part of your question. I can't remember what the first part.
If a chief were to ask.
So I have regular meetings with the chief, and we have a communication protocol if there were to be a case involving a First Nation community, where we still protect the personal health information as we are obliged to do so, whether we're under an emergency or not. We do our utmost to protect the individual personal health information. However, that does not prevent us from having conversations with the chief or with other leaders about a case that may be occurring in a community, just so that they can help to calm any fears, to know what's going on within their own community, but without publicizing that community or case without publicizing information about that individual to the community, and without publicizing the name of the community to the larger Yukon community.
Thank you. We'll move on to Juliette, Aurore Boreal.
Yes, I have no questions.
Go ahead, please. Oh, he has no questions. Sorry. I thought he had some questions. Gabrielle, Whitehorse Star.
Hi, can you provide some details about what the response plan for the communities looks like? Are they unique according to community? And how are the communities supplied with test kits, PPEs, or ventilators? Is it according to need?
I assume that question is for me. The community response is kind of all of the above. The question was about what does the response plan for the communities look like? So there are, let's say, multiple levels of community response plans being worked out. The healthcare response is very much aligned with what we do every day for community healthcare response. If we have a case in a rural community, for example, similar to what we've described for recent cases in Whitehorse, there would be very little difference. Now, there may be individual circumstances, such as household configurations, that may prevent safe self-isolation within a house, either in Whitehorse or in a community. But in general, if a person can safely self-isolate at home, does not need medical intervention, then the management of that case and contact tracing would occur in a rural community just like it does in Whitehorse. In terms of if that individual needed medical treatment, then there are systems in place for referral, for triage at the health center, for referral to Whitehorse following using our regular EMS pathways and with appropriate infection control precautions already prepared for and worked out. Other layers of community response plans include more of the larger picture of communication to a community, making sure that every community has response plans in terms of facilities, looking at potential facilities or existing facilities to help with self-isolation, and protocols for prevention, and guidance, public health guidance for caring for sick individuals, say within a family. All of those other measures are being addressed, whether in communications to chiefs and councils, or to municipal leaders, or in other community representatives, interagency groups, etc. So we actually have a whole team within our Health Emergency Operations Center that is working on community response.
Sorry, there. So there is the whole health response, and there's also an emergency response where we work with each community. And maybe I know that we're in regular contact with our communities, municipalities, First Nations. We have liaisons set up, and maybe Diarmuid could add a little bit of information around how we're dealing with it on the emergency side for each of our communities.
Thank you, Minister. So planning has been underway specifically for the COVID issue for a few months now, as Dr. Hanley pointed out and Minister Streicker. We've been working closely to support the operations of the Health Operations Center, including their planning for contingencies in the communities of the Yukon. What this means is that while the health response itself will be led by the Health Emergency Operations Center and their teams that are working on this, the ancillary supports that will go into that with logistics, additional staffing, or activations of community emergency management plans can be coordinated and will be coordinated through the Emergency Coordination Center. So we maintain contact with all the communities in the Yukon. We have established liaisons, and we stand by ready to assist any of the communities in the event that they need our assistance, and happy to support them with their planning goals and needs.
Gabrielle, do you have another question?
Yeah, I have a follow-up question for Mr. O'Donovan. I'm wondering, there was mention that there's now SEMA officers stationed as of today. That happened really quickly. Where did that pool of officers come from?
Thank you for the question. We're fortunate to have a number of different resources to draw upon for these SEMA enforcement officers. For the two specific locations at the Watson Lake area, we're drawing upon conservation officers and natural resource officers from the Departments of Environment and EMR. They're doing the initial staffing of the two border stations down in the Watson area. We have additional resources from a few different branches and departments here in Whitehorse that are greeting passengers as they come off the planes at the Whitehorse Airport. In addition to that, at the international border crossings between Skagway and Carcross, Haines and Haines Junction, and the Beaver Creek area, we're relying on our partners at the Canada Border Services Agency who are working in coordination and cooperation with our teams to both collect the desired information and impart the advice of the Chief Medical Officer of Health of the conditions in place, the restrictions in place that are now here in the Yukon with the ministerial orders.
Thank you. We'll move to Mario at Radio-Canada.
Hi, yes. I guess my question is for Dr. Hanley. Just, with the new case, what does the new case change in the work that you guys do? Does it change anything?
The question is about, did you want me to answer in French or in English?
English is fine. Okay.
So the question is about what does a seventh case change from a sixth case, and I think it goes back to that. At the beginning, I was talking about how we expect to see cases like and we expect to see cases continue like this. And we feel confident that we are still in that containment phase where when we see a case like this, they have been consistently related to one of two things, either to travel outside the territory, including either domestic or international travel, or they are known contacts. They are contacts of a known case. And so this is the kind of the expected pattern. We will see more. So no, one case like this does not change our strategy, our management. Our strategy really is based on the risk of incursion of undetected cases. We are looking for anything that flags community transmission. Where we're looking to make sure that we're attuned with our testing strategy, that we are picking up any signals of community transmission or anyone who may have perhaps not been complying with self-isolation who's returned from travel. So we're really looking at the risks for worsening of this COVID pandemic, while at the same time mopping up, as it were, these individual cases that are quite distinctly travel or contact related.
Do you have another question, Mario?
Mentioned that, yeah. You hear me?
Go ahead.
Yeah. Well, basically, you mentioned that, these cases are not what's making you not sleep at night. Is there anything in this, in the way that you guys are working that is, making you, I guess, anxious or anything like that?
The question is there anything that's making me, well, it's thinking of the words for my next media update, perhaps. But otherwise, no, I think we're confident, but we're vigilant. I think that would be what I would say. We have to continually revise what we're doing. And that a lot of that is based on what we are seeing, not only south of our borders, in the rest of Canada, in terms of how the epidemic or pandemic is unrolling in the provinces, but also internationally, continually revising according to what we're learning from international experience, whether that's China, whether it's Europe, whether it's in the United States, or whether it's Ontario and Quebec. We still remain in a very fortunate position that we have that chance to learn not only from evolving research, the increasingly sophisticated epidemiology, but the lessons of our lessons being learned by our colleagues around the country.
Move on. John, Yukon News.
I don't have any questions.
Okay, then we'll go to Tim from CKRW.
Good afternoon, Dr. Hanley. Just wanted to follow up about testing again. I know in previous press conferences, you'd said, like, okay, you're going to test those who had traveled or who had immediate contact with those who had traveled. Now I'm starting to hear of just others who are developing symptoms and they want to be tested. Is the threshold now being lowered to be like, hey, if you are showing symptoms, even though you haven't traveled or been in direct contact with someone, are those people now getting tested? And as a little bit of a follow-up there, for test kits, like, do we have enough test kits to go to that level?
So we're continually revising our testing strategy. So we continue to have one of the highest testing rates in the country, if not in the world. So we are very aggressive with our testing. Our threshold for testing always has depended on a discretionary element. So if there, for instance, although the highest risk is definitely travel related, we also, though, have a lower threshold for testing in people from rural Yukon, in people who are more vulnerable, and so we leave that discretion to the conversation on the phone, to the healthcare provider to test, even if the exact indications are not present. But really, where the focus is making sure that we are getting those people with travel. Because that's where we're going to find the cases. At the same time, having that kind of lots of people testing. Another example is everyone who's hospitalized who's hospitalized with influenza-like symptoms has a test for COVID. Every time an influenza swab is taken, we add a COVID test. So we have lots of ways that are looking for signals. We are careful about ramping up testing too fast without a strategic approach, and that's because we want to make sure that we are not missing the people at highest risk. The other part I would add to that is we are confident about supplies. We're not looking at supply shortages, so that is not a limiting factor for us. And also to repeat, as I've said before, that testing, Yukon and other northern sites are priority for testing at the laboratories in the south. So, which means that we are able to, we are not in a position of having to scale back testing as is occurring in the provinces.
But people are traveling less, though, now. So does that threshold, are we getting to that threshold where you will test those who are showing symptoms?
let's just say that that's a direction that we're looking at, and we're looking at that really in these days to look at if we are to do that. Let's make sure we're going to do that in a way that we don't get overrun in capacity for testing and then affect our turnaround time. We've got time to decide that. It's a matter of when is that going to be the best time to take the next step.
And finally, believe it or not, as you alluded to earlier, Easter is around the corner, and then April 15th is right after Easter. Are we going to be having a decision on schools forthcoming here shortly?
So we are working very closely with the Minister of Education and the Department of Education, and doing planning for the various options around that. So I would say stay tuned, and you will hear shortly.
We actually have time for one more question if someone on the phone has one. Hearing
I
no.
have a question.
Sorry, go ahead, please.
Thanks, this is Gabrielle again. I'm wondering, now that we have these kind of border stops set up, or these road stops, what is happening as far as enforcement to make sure people passing through aren't making stops at the store and et cetera?
So I think someone said earlier during the question and answer, we brought in place these new laws on Thursday. By today, we had the enforcement officers in place. So there's, of course, more work to do. The first thing that will happen is that we're coordinating it all centrally, and Diarmuid can talk a bit about that. So we'll be running a database to check off sort of at both ends when people enter into the territory and leave the territory, and check to make sure. The next phase that we're working on is to deal more within the territory and to deal with the orders that we brought in around gatherings and other issues, that to reinforce what Dr. Hanley has directed us to do. So that work is ongoing now. I can ask Diarmuid to add more information to that, Gabrielle. And I think over time we'll continue to update you on how that's progressing. And just to acknowledge the tremendous amount of work that all the folks did over the weekend to get us up and running for Monday morning. But Diarmuid, maybe you can add a little bit of how that's going to shape.
Thank you, Minister Streicker. And yes, direction is being provided to each of the SEMA enforcement officers at the border check stops to provide to travelers through the Yukon. If they're transiting through the Yukon, they're being instructed that they have 24 hours to complete their transit through the Yukon. They're also being instructed to minimize their interactions with the public and with others in general in the Yukon as they do their transit. They are to minimize their stops. They are to go as directly through the territory as possible. As Minister Streicker has indicated, we are tracking those entries and departures, and we'll be following up to ensure that folks do move on in the manner that we've instructed. What we've done is provide a mechanism to reinforce the awareness of the responsibility that we all have to adhere to the directions of the Chief Medical Officer of Health and to take these actions into our own hands, our responsibilities for limiting the transmission of COVID-19. These instructions being passed to travelers into the Yukon will help them achieve the realization of those responsibilities.
Thank you very much.